Good evening, everyone, and welcome to RFL. I'm Richard French. A tremendous amount of revisionist history right there, but let us press on. Some signs of hope in the fight against coronavirus, but the battle, it is far from over.
This week is going to be the peak week. It's going to be the peak hospitalization, peak ICU week, and unfortunately, peak death week.
Certainly in a lot of states interviewing area. Let's get right to those latest numbers, which continue to go up. We now have nearly 400,000 confirmed cases in the United States. More than 12,000 people have died. That number believed to be an undercounting, as they still haven't been able to tabulate for the cases of death for so many. New York continues to have the most cases. We'll get to that in a minute. Also, 2/3 of the metropolitan areas in the country now have at least one person who has died from the virus. Worldwide, we are approaching 1.5 million cases. More than 81,000 people have died. The virus, it has now been detected in at least 175 countries. The United States has the most cases. Italy and Spain continue to have the most fatalities. 17,000 Italians have died, and so have 14,000 people in Spain. Back in the States, New York State has had its deadliest day yet, 731 people passing away since Monday. So far, 5,500 New Yorkers, they've died from the virus, more than half of them in the 5 boroughs. Despite all of that, Governor Cuomo says there is a glimmer of hope.
Right now, we're projecting that we are reaching a plateau in the total number of hospitalizations, and you can see the growth, and you see it starting to flatten. You see that plateauing. That's because of what we are doing. If we don't do what we are doing, that is a much different curve.
But Cuomo warns that even though there are some hopeful signs, it is not over, and not by a long shot. The Surgeon General says New York is not the only state showing, though, hopes of plateauing the curve.
When you look at Washington and California, and even New York and New Jersey, they have truly started to flatten their curve.
But on the front lines, the situation can only be described as dire. In New York City, nearly 2/3 of the nurses just surveyed by the state's Nurse Association say they do not have the proper gear. In fact, nurses in a number of hospitals across the 5 boroughs, they have been protesting, saying they don't have adequate equipment. The latest demonstration that happened at Harlem Hospital yesterday, when about 80 people gathered.
We're demanding that we have a better policy for N95s. Right now, it's kind of come to, us using 1 for 5 shifts, which is up to 60 hours of work with the same mask. Those haven't been proven to be effective for that length of time, and it's not a risk that we're willing to take.
Now, just north of the city, Westchester County is also dealing with a large outbreak. With the death toll there climbing above 200, a morgue trailer is now being shipped to the county as hospitals struggle to deal with the number of bodies. You may remember that the city of New Rochelle in Westchester was one of the first epicenters nationwide. It's a containment zone, in fact, was instituted to stop the spread. And now let's bring in our next guest, Dr. Michael Palumbo. He's the Executive Vice President and Chief Medical Officer at White Plains Hospital in Westchester County. Doctor, thank you for the time.
Thank you for having me.
Please take us inside the ICU. Just how seemingly unending has this pandemic been here, and has it overwhelmed the system?
So, looking at the ICUs, the rate of change has been fairly unfathomable. And no matter how much planning you do for these kinds of things, the reality can be daunting. So just to give you a sense of what's gone on at White Plains Hospital, we've expanded our ICU capacity in certainly less than 2 weeks, probably closer to 6 days, from 16 beds to 83 beds, which represents a 5-fold increase in the number of ICU beds. And the amount of resources that's necessary to do that requires so much support from multiple levels in the organization. Obviously, the doctors, the nurses, but the engineering people, putting up walls, creating negative pressure space. It's really quite daunting, but we had advanced planning. In fact, all hospitals have advanced emergency preparedness planning like this. So we're ready. But then again, to your question, when you have the actuality of it, it really requires a tremendous amount of organization. And speaking for my own organization, I'm extremely proud of how everyone was ready to go.
You know, Governor Cuomo, doctor, said something today where he compared the scenario to redlining. I want to play the soundbite for our audience.
The system is running at redline, has been for days. This is the most intense management function that we have ever undertaken. So it's not here, in this situation, it's not what they want, it's what they need.
To that point, you've been running at full capacity or close to it nonstop, and you don't see the end around the corner. How taxing has that been for those frontline responders?
Certainly extremely taxing, but, and I appreciate the governor's comments. I think they're valid, but I would expand the focus a little bit so that it's easy to think about the number of hours that people are putting in, though we have been faithful to our employees, whether they're nurses, whether they're technicians, whether they're physicians, in terms of having an appropriate number of shifts, having appropriate lengths of shifts. So from my perspective, it's not so much about the amount of work, it's the type of work. And this is a very emotionally difficult situation, whether you look at it from the perspective that all healthcare workers have, that we have a dedication. This is what we signed on for. We're here to take care of patients, to protect our communities. So that's not the problem. But then when you're dealing with a disease that is as difficult as this, unfortunately, sometimes deadly, the emotional toll that takes on the workers is very significant. That's superimposed on their own personal fears for themselves, for their families. The combination of that is very challenging, and we've been doing everything that we can to let our workers know how much we appreciate it. We're so grateful to the community. You've been seeing on the news broadcasts the tributes from local police departments, local fire departments, people cheering at 7 p.m. It's all very meaningful and helpful, but I don't want to underestimate the significance of it all.
I would imagine particularly daunting for the staff is the expectation, at least coming out of China, where this was almost exclusively or overwhelmingly the elderly that were susceptible to this. But we've seen younger people, haven't we, doctor? Seemingly healthy patients that have fallen victim to COVID-19.
Yeah, certainly. And, for the audience, I'd like to just put this in sort of the bigger perspective, that we know that about 80% of patients who become infected with COVID are able to stay home and manage their illness at home. So that's still the overwhelming majority. About 20% require hospitalization. And you're right that we are seeing a mixture of older and younger people in that. Although if we look, not so much as the Chinese experience, but the European experience in Italy and in Spain, they were certainly seeing this as well. But again, getting back to your prior question about the strain on the health care staff, and particularly the emotional strain, certainly seeing younger people very ill, even requiring ICU care, is that much more challenging. And I would love to have you invite me back a year from now when we understand more about this virus, and I can tell you why this is happening when we know what those pathogenic features are. But right now we're still learning as we go, and there aren't good answers to why are some young people stricken more severely than you might otherwise expect.
And piggybacking off that point about so many of the unknowns here, we've seen in Asia, in Singapore, and South Korea, already there's a second wave, if you will, when they've reopened the country. To that point, how concerned are you that when the public hears today, and it's good news here, some optimistic projections that we're flattening the curve, and you got the spring weather here, that social distancing will be prematurely ignored, again, taxing the system that you've been trying to keep going here, once again, if we're not careful?
That's such an important point, because as a professional, I would think people would get it, that this is so necessary, that you have to comply. And then, like you, I see on the news, up until recently, young people congregating on beaches in Florida, or congregants worshiping together in Louisiana. And I have to realize that not everyone gets it. And therefore, as we start to flatten the curve, we're really going to need to rely on all of us, the media, the government, to consistently give this message, stress the importance, and enforce it, unfortunately. And you played the clip of the governor a minute ago. I think he's been doing a great job in being on the television, in addressing the public directly in words that they can understand. But to get back to your point, this isn't going to be over in 5 days or 2 weeks. And we are very concerned that this virus has the potential to come back. So we'll need to see what that means in terms of the length of time that people need to shelter at home and maintain social distance. But my personal opinion is that we certainly have weeks to months of that in order to ensure the public safety and health.
And finally, Doctor, you already said, and I know it's genuine, how unbelievably proud you are of your hospital's response and also medical professionals everywhere, but you're not out of the woods yet. You guys still need help, correct?
Very much. So, and to your point, I mentioned that we have emergency planning that's always in place, and there's even some money that's budgeted for that. But this situation has been overwhelming. The need to respond quickly. I talked about building out units, hiring staff. It goes on, and we haven't touched on the challenges around buying masks and other protective equipment, and how, unfortunately, there was price gouging out there, but we needed to buy this to protect our staff so that they could take care of patients. So you do whatever is necessary. But we're very concerned about that massive amount of capital outlay. I can assure you every hospital is worried about that. We're hearing about what the federal government may be able to do to help us later, what the state may be able to do. But ultimately, we're so grateful for anything that the community can do to help. And we've been overwhelmed with that generosity. When I tell you that every day, so much food comes in from the community so that the staff can get a meal, creative ideas, it's really heartwarming, and is part of our reassurance that they understand that we're doing this for them. But as long as I'm on the air, I would certainly like to say that we and your local hospital, whomever that may be, is very appreciative of financial support to help us deal with situations like this.
Well, Dr. Palumbo, thank you and all the other folks with you on the front lines. And I know it goes beyond just the medical staff. So keep up the good fight and keep safe. Thank you.
Thank you, Richard. I appreciate your having me on.
These past several weeks, doctors and nurses and so many more have revealed themselves to be heroes in scrubs, demonstrating an unforgettable display of selflessness, commitment, and compassion in response to the COVID-19 pandemic. Hospitals, they're doing everything they can to combat this virus with limited staff, resources, and supplies. They've had to transform their facilities to meet the needs of a sudden influx of critical care patients, incurring costs in the millions to care for our community. We broadcast RFL from Westchester County. It's just outside of New York City. The county became national news when it became the original epicenter of the virus, and White Plains Hospital, the closest hospital to our broadcast facility, was among the first medical facilities to join the fight. It is a fight a long way from being finished. It costs approximately $250,000 to convert a unit to an ICU to care for critical COVID-19 patients. Hospitals like White Plains, the hospital in our backyard, have done this multiple times in just the past 3 weeks to accommodate the patient volume that they're seeing. Well, tonight, RNN TV is issuing a challenge to other companies throughout our immediate community. We are pledging a gift of $125,000 to White Plains Hospital to cover half the cost of one ICU unit conversion. And we ask that another company step up and match us with the other half. So please join us. Reach out to White Plains Hospital Foundation at 914-849-GIVE or visit their website at wphospital.org COVID-19 help. But our generosity does not have to end there, folks. We reach out to you folks watching us in other markets across this country. If you can please reach into your pockets, corporately or individually, and help those hospitals who are helping you, it will make a difference. Our hospitals, they're there for us when we need them. Now, they need us. It is vital that we support our local hospitals in its fight to overcome this crisis. What the staff is doing is truly heroic, and we all owe them a tremendous amount of gratitude. Up next, we will turn our eyes back to Washington to hear Donald Trump tell it he has yet to make a mistake, an oversight, or an error in dealing with the coronavirus outbreak. Of course, we know that's not the case, but the depth and width of the errors made may shock you. We're going to fact check the president. That next.